All right, my name is Daniel Welch. I'm a nurse practitioner student for Maryville University. This is Nursing 612 Head to Toe Assessment. This is my patient, 24-year-old female. She has emptied her bladder, put on her gown, and her vital signs were taken. Her vital signs were 116/68. Respiratory rate is 14. Her pulse was 58. Her temperature was 36.5. Starting our head to toe assessment with the head. Her hair is evenly distributed brown hair. She does have highlights. Normal cephalic. As I touch, I'm just going to palpate for any abnormalities or lesions. Does this hurt at all?
No.
Good. Her hair is free of dandruff flakes and is evenly distributed throughout. Noticing her ears, they are evenly distributed, equal on both sides. Does that hurt at all?
No.
Nothing like that. Noticing the symmetry of her eyes. Her eyes are symmetric to her ears, and those are both symmetric to her head. I'm going to do a light touch sensation, so just close your eyes and tell me if you can feel this. So I have just a light thing that I...
Yes.
You feel that?
Yes.
And that?
Yes.
And that, and that. Light touch sensation positive on the forehead, cheeks, and chin. Now her eyes, her eyelashes and her eyelids are both full and free of abnormalities. Her eyes closed symmetrically. We're going to do visual fields, so just look at my fingers and keep your head straight. Over and up, down, and this side, over and up, and down. Her visual fields are intact. No nystagmus, no strabismus as she went through those visual fields. We did a Snellen chart that confirmed 20/20 vision. The patient does wear contacts during the day and glasses when she takes her contacts out. Looking at her eyes, her conjunctivas are clear. Her scleras are white. No nystagmus or ptosis. Upon using my ophthalmoscope, I'm just going to have you look at the light here. Her pupils are both equal and round and reactive to light on both sides. As I check, they both work. They're both accommodating. As I get close, I'm checking for red reflex on the left eye and right eye, and bilateral red reflex. I'm going to do one more time. I'm just going to look deep into your eye for your optic discs here. Let's see, block out something. Very good. Upon using my ophthalmoscope, she had bilateral optic discs are visible with flat and sharp margins. Her blood vessels were present without any hemorrhages or apparent retinal defects, proving cranial nerve 2 optic nerve is intact. We're going to do a cover and uncover test. So I have a piece of paper. I'm just going to cover one eye, and you just look at me straight as I cover one eye, and then just follow my finger over and up. Good. Her left eye articulated smoothly, same with the right eye, up and down, with no strabismus or malalignment. Going through the primary vision fields that proved cranial nerve 6 abducens is intact. Patient did have pupillary responses proving cranial nerve 3 and cranial nerve 4. Oculomotor and trochlear nerves are intact. Now on her ears, I'm just going to prepare my scope. External examination. Her ears are equal, bilateral, symmetric. Palpating her auricle once before like we did. Is that painful at all?
No.
Very good. Free of pain upon palpation. I'm going to do a whisper test, so I whisper 3 words in each side.
Popsicle hat scissors.
Very good. And
Blue cloud rain.
very good. She passed the whisper test 3 out of 3. I'm going to look at her tympanic membranes, lifting her ear up and out slightly. Very good on that left ear. And the right ear. Very good. Tympanic membranes are easily visible with minimal cerumen, bilateral, no bulging, good light reflex, no protrusions, no retractions. I'm going to perform a Weber test. I have a tuning fork. I'm going to strike the tuning fork, place it midline on your skull. You just tell me if you can hear it on both sides.
Yes.
Very good. And then I'm going to do the Rene test. So Weber test proved even bilateral bone conduction, and her hearing was noted. So now we're going to do the Rene test. So I'm going to strike the tuning fork, place the stem of the tuning fork on your mastoid bone just behind your ear, and you just tell me how long until the sound goes away using my watch. Very good. Now I'm going to strike the tuning fork again and place it close to your ear. And then again, you just tell me when the sound is gone.
Gone.
Very good. Now I'm going to do it again on this side. Let me get a good strike here.
Gone.
Very good. Once again. Very good. So that test proved that air conduction is twice as long as bone conduction, also proving that the cranial nerve 8 acoustic nerve is intact. Now for the nose. Her nose is midline with my scope. I'm just going to look up your nose, so just tip your head back just a little bit. I'm just going to look, looking for any septal deviations. Her turbinates are visible. Breathe through both your nose. Are they both clear?
Yes.
I'm just going to occlude the left one. Breathe. Or right one, I meant. Occlude this other one. And you're able to breathe through both your nose. Both of her nares are patent. No deformities noted. No septal deviations. With your eyes closed, I'm going to have you determine the smell of 2 different items, and I have candles that smell differently. So close your eyes and tell me what this is, the smell.
Cinnamon.
Very good. And this one?
Pineapple.
Very good. So this was a cinnamon, and this was a pineapple candle, so she did just fine. All right. Now, with my scope, I'm going to look in her mouth, look at her teeth and everything, so just open up, nice normal breaths. Her lips and lips are pink and moist. Her buccal mucosa is also pink and moist. All of her teeth are there. Do you have any cankers or abnormalities in your mouth? Her gums are even and firmly attached to her teeth. Very good. I'm going to have you say ah.
Ah.
Very good. As she says on, her soft palate and her uvula rise, noting cranial nerve 10, the vagus nerve, is intact. With a tongue depressor, I'm going to check the gag reflex. So just open your mouth and close your eyes, and with this tongue depressor, first of all, I'm just going to look back there, looking at her pillars. She has had her tonsils removed as a child. There is no mouth odor, and I'm just going to check. The gag reflex is intact. I'm going to ask you if you can puff out your cheeks and smile and frown and raise your eyebrows and shrug your shoulders. So those prove cranial nerve 7, facial nerve is intact. Can you move your tongue side to side, up and down? Lift your tongue up and let me look at that. Very good. No abnormalities noted. Patient can articulate her tongue smoothly with no fasciculations, proving hypoglossal nerve is intact. Now moving down on her neck. Her trachea is midline. She has uniform symmetry of the neck and thyroid. I'm going to just have you move your neck side to side. Is there any catching or anything side to side?
No.
I'm going to have you swallow. Is it painful to swallow?
No.
I'm just going to once again palpate and swallow one more time. Very good. Her trachea moves midline, symmetrical to her neck. Absence of jugular venous distension as she is sitting upright here. Right now I'm going to palpate your carotid pulses one at a time. Her left is +2 in strength, as well as her right, equal bilateral. While I'm here, also no bruit was noted on that pulse. While I'm here, I'm going to palpate lymph nodes. So post-auricular, as I just move around, and you let me know if any of this is tender or painful. Pre-auricular, occipital, submental, submandibular, this one, and then submental, superficial cervical chain, posterior cervical chain, supraclavicular. Is any of that tender at all?
No.
No abnormalities noted. I think that's it for there. Upper extremities. I'm just going to look at her arms. Feeling for any warmthness in the joints. No swelling, edema, or atrophy. Her skin turgor is 2. Her skin is pink and moist. And now for the pulses, I'm going to do radial pulses on both arms. And they are +2 and equal bilaterally, and then brachial pulses also on both arms. And they are also +2 and equal bilaterally. Are you able to shrug? Oh, bless you.
Excuse me.
Are you able to shrug your shoulders okay? Against some resistance. She shrugged her shoulders with no resistance, and then with resistance, proving spinal accessory nerve is intact. Okay, back and shoulders. So I'm just going to, back and posterior chest. I'm going to have you just spin around. As I look at her back, I notice thoracic configuration is symmetric. Her respiratory rate is even. I'm going to palpate and percuss at the costovertebral angle. Does any of this hurt at all?
No.
So as I palpate on both sides for any kidney tenderness, and then I'm going to just percuss just a light with the fist. Is that tender at all there?
No.
Alright. So no tenderness at the costal vertebral angle. Right here, her respiratory rhythm is normal, unlabored, and equal posterior, and lateral. She's got lateral and posterior equal chest expansion. Palpating for tactile fremitus. Just keep breathing your normal pattern, and I'm just gonna kind of, rub my hands along, feeling for any tactile fremitus in a back and forth motion across her back. And no tactile fremitus is noted. Now I'm going to assess for diaphragmatic excursion. I have a skin marking pen and a tape measure here. I'm going to put the tape measure down. Keep my skin marking pen handy. Just breathe normally as I percuss dullness, diaphragmatic dullness. Alright, so now I'm just going to have you take a big deep breath in and hold it. And I'm percussing down the scapular line. Okay. As I make a note with my pen, now exhale. Very good. Now take a few deep breaths. And then the next time I'm going to have you exhale and hold it. Alright. And hold it. As I percuss, I note for dullness. And I found on there. Now breathe. Now continue. Now inhale. I'm going to repeat the procedure on the patient's left side. Again, scapular line. I find dullness. The patient has inhaled. I find where my percussion dullness changes in. Breathe. Take a few breaths to catch up. And then exhale and hold it. As I percuss, coming up the scapular line, I note the changes. With my marking pen down, I get my tape measure, and I measure from point to point. This one measures 5.2, and this one measures 5.5, consistent with previous examinations of this patient. Posterior, I'm now going to auscultate breath sounds, so just continue to breathe normally. Posterior. And lateral. Very good. Breath sounds are clear. Right posterior lobe is clear. Left, right posterior and lateral, and left posterior lateral are clear. And they're equal compared to both sides on this posterior side with no rails, crackles, or wheezes. Alright, anterior chest, I'm just going to have you swing around. Anterior chest, noting the skin is pink and moist. Her turgor is +2 on her skin, on her chest. As I note, no pericardium, no thrills as I palpate. No heaves or pulsations as I palpate aortic pulse. There. Now I'm going to listen for heart sounds, S1 and S2, in aortic, pulmonic, herbs, point, tricuspid, and mitral. I'm going to auscultate. S1 and S2 heart sounds are auscultated in those points: aortic, pulmonic, tricuspid, mitral, and herbs point. Now I'm going to light palpate and deep palpate your abdomen. First of all, I am lightly palpating. Is any of this? Her abdomen is soft and tender. No masses noted. Is any of that tender?
No.
On her abdomen. And then I will auscultate for bowel sounds as well as pulses. So I'm just going to listen to your belly here a little bit. Bowel sounds are active in all four quadrants. Okay. Aortic, renal, iliac, and femoral arteries are auscultated with no bruits noted and no tenderness. Now I'm going to percuss for the liver border. So percussion of liver borders on the patient's left side, and then splenic dullness on the right side here. Noting a left costal margin and the right costal margins. Right there. Left and right kidneys. And then midline for aortic pulsation. And noting her abdominal muscles are intact. Any hernias? No. No hernias. Umbilical and inguinal palpation. Any tenderness there?
No.
Very good. And then also we did deep palpation also. Very good. No tenderness? Nothing there?
No.
Very good. Alright, now legs and feet and lower extremities. As I look at her legs and feet, her skin is intact. It is pink. It is moist. Both lower extremities are symmetric, both sides. Absence of hair. Patient shaves regularly. Her muscle mass is uniform. No edema. Noted. As I check for pulses, dorsalis pedis pulse, is +2. Her tibial pulse is also +2 on her left and all on her right also. Very good. Can you move your feet both? Very good. Can you lift up against me? So her strength is equal on both sides. Strength is rated 5 out of 5. Now I'm going to assess for reflexes as I use my reflex hammer. So my first will be my knee reflex. So as I find, is that it?
Yeah.
And then let it go limp. Is that it?
Yeah.
Very good. And then Achilles. So just nice. Very good. Very good. And then also brachial. So as I lift this up, just let it go limp just like this. Very good. And then same thing here, just let this one go limp. You get it right there? Very good. Brachial knee and Achilles reflexes are all +2 and equal bilateral. I want you to close your eyes and bring your finger to your nose on your left. Very good. Finger to your nose on your right. Very good. Upper and lower extremities, strength 5 + 5. Patient able to perform finger to nose bilaterally without difficulty. This concludes our head to toe assessment for Nursing 612, Maryville University. Thank you very much.